America spends more than any other country on healthcare, 17.9% of GDP in 2011. This number is expected to rise at an annual rate of 5.8% from 2012 to 2022. This high level of spending is due to Americans overspending for the same services, stemming from a lack of collective bargaining power present in other countries. This collective bargaining power is why Medicare and AARP members pay lower prices.
We're self-insured, so we fund our own and pay our own claims. However, the national trend in healthcare has increased. Now, when we look at our cost, our actual cost, over 10 years, between the county and the school division, we used to pay in a year, 2005 fiscal year, our costs were almost $12 million. We now, for the last 2 years, and we believe this year, we're running at about $24 million. So you can see there is an increase. Like I said, we're trending less than the national average, but overall, healthcare costs are increasing.
How does this affect the schools?
Historically, government workers, school division, and local government, we've not typically made the market wage, but what we have had is the ability to have very good health insurance and other benefits. So a lot of people will work for a government or school division because of the benefits. What we're seeing is we're having to make changes to that. One of the things is the Affordable Health Care Act, and the Affordable Health Care Act is putting regulations on us saying that you have to provide a certain level of health care, but it can't be too good. So if your health care is not at a certain level, you will start getting fines and penalties. But if your health care is too good, and they actually use the term Cadillac plan, so if you have what they consider a Cadillac plan, then around 2017, 2018, we have the potential, excuse me, to have what they consider a healthcare Cadillac plan, and we'll get an excise tax. It's 40%. So it really has changed what we used to be considered typically a lower paying job with great benefits to now we're having to recognize we may have to shift. We may have to start paying higher wages because our benefits are just not going to be as rich. And when you get to that point, you still have to compete with other jurisdictions for teachers and employees. So you're constantly, trying to maintain a proper balance between wages and benefits so that you can attract employees.
A key part of these price increases is the for-profit nature of America's health care system.
Could the same level of care be given if the hospital was subsidized by the government rather than being a profit-based industry?
I think so. However, there are going to be some differences. I think in emergency care, it would be great. It would be the same. I think otherwise, other services, if you've got to schedule an operation, things of that nature, I think what you're going to find are longer wait times. One of the things we're starting to see with the Affordable Care Act and the Medicare changes are fewer physicians. Folks are not going into medicine. A lot of physicians are retiring. And of course, that's going to trickle down. Versus, used to be if you had to have shoulder surgery, let's say they would schedule you a month from now. I think as you have less physicians, that's going to increase. I think if it were government subsidized medicine, that's exactly what would happen. Obviously, if you're a doctor, physician, or let's say a surgeon, and you get paid the same amount of money whether you do 100 surgeries a month or you do 20. I think human nature, most folks are going to go for the 20 instead of the 100 because they're getting reimbursed the same amount. So what I think would happen is it's going to slow down the level of care that everyone receives.
Are there any ways in which the Affordable Health Care Act will affect the day-to-day operations of the hospital?
Well, one of the ways it affects us is reimbursement. A lot of people don't realize that when you take Medicare, Medicaid patients, you don't get dollar for dollar reimbursement. So I know right now with the Affordable Care Act, the Medicaid is giving us 62 cents on the dollar. So in other words, if a patient has a bill for $1,000, we'll get $620. Another thing is the new Medicare Act is cutting physicians' reimbursement by 24%. That started April 1st. There are other things that they throw down. Another thing that they do now, it's called value-based purchasing. And hospitals are, there are 7 different questions that folks who have been in the hospital are called and asked once they get out. Your scores on those reflect the amount of money you get back. So in other words, Medicare will hold 1% of the money that they would pay you. Based on your scores, you earn that back. And that's why you're going to hear a lot more about patient-centered care, patient-focused care, and that's because hospitals need to score well on those 7 questions, and that has to do with how you were treated in the hospital, things of that nature. One of the other things is hospitals are now, as part of the Affordable Care Act, responsible for readmission rates. So if you are in the hospital for a certain condition, once you're discharged, there's a certain time period, I believe it's 3 months. If you are readmitted for the same problem, the hospital is penalized for that financially by Medicare and Medicaid, which is very difficult because, of course, it's hard to control what people do when they get out of the hospital. So if someone's been told to take their meds, to lose weight, to stop smoking, to stop eating fast food, it's pretty hard for the hospital to, hold them accountable for that. They're living their lives. But yet if they come back with the same problem, the hospital is on the hook for that.
In the end, America's healthcare system is vastly flawed, and it will remain this way until people recognize the problems inherent in our current system and act upon them. That is why I beg you to contact your congressman and ask what he is doing to combat this national crisis.